Welcome to the Functional and Integrative Medicine Podcast. This podcast is all about exploring root cause medicine, showcasing the power of this approach, and inspiring other medical providers to follow this incredible path. I'm your host, Ginger Allen, and founder of Your Medical Liaison, a medical marketing agency working with medical providers since 2012. My passion for root cause medicine and provider advocacy drives me to help medical providers who have incorporated functional and integrative medicine into their practices. So let's dive in. Welcome Dr. Matt Bernstein to the podcast. He is a Harvard-trained psychiatrist, educator, and thought leader who's bridging the gap between traditional psychiatry and functional root cause approaches to mental wellness. After graduating summa cum laude from Columbia University and earning his MD from the University of Pennsylvania School of Medicine, Dr. Bernstein completed his psychiatric residency at the renowned MGH McLean program, where he served as chief resident. He went on to hold several leadership roles at McLean Hospital, including assistant medical director of the schizophrenia and bipolar inpatient program and medical director of the substance abuse residential treatment program. Today, Dr. Bernstein continues to teach through McLean and Harvard Medical School while also running a private practice that blends psychopharmacology with psychotherapy and integrative strategies. His passion lies in exploring how metabolism, nutrition, and exercise can impact brain function and helping patients move beyond symptom suppression to achieve optimal mental health. So excited to have you on the show. How you doing, Dr. Bernstein?
I'm doing well. Thanks for having me.
Thank you so much for taking time out of your busy clinic to meet with us. So I shared with you before we got on that you're the second functional psychiatrist I've ever met. So you guys are a really rare breed and really special to me because I'm very passionate about mental health and, addiction recovery. So having you guys, somebody like you on the show is just really, really special. So thank you again. So again, our podcast is really for providers. So speaking to other providers, and I have a psychiatrist that I work with, pretty large group, and I'm really encouraging them, to get some of this fellowship training and functional medicine. So I'm so excited to have you on here to just inspire other psychiatrists to take a look at this because it's really I think going to change psychiatry.
I think so too. Yeah, I agree.
So yeah, if you could just share a little bit of your professional journey and how you got into functional and integrative medicine, being a psychiatrist.
Yeah. Well, I've always been open-minded and really focused on achieving the best outcomes I can for people who I'm taking care of, especially my passion's always been working with people with more severe illnesses like schizophrenia, bipolar, schizoaffective disorder, severe major depression, severe OCD, PTSD, people who are really, I used to work on an inpatient unit for a long time at McLean. So I've always worked with that population. And we can stabilize people with medications. We can sometimes help beyond that with some psychotherapy, but psychiatry really doesn't do that great of a job at getting people all the way back to wellness when they've had those types of diagnoses. And I think, I feel bad saying that, but that's my profession. I've been doing it for 25 years and I have to call it like I see it, that we just don't get people from, being on an inpatient unit for a severe episode to back living to their potential, like living alone or getting married and having a full-time job. It just doesn't happen that often, that sort of full recovery. And instead we, put people on these medications that really do bad things to their metabolism and their physical health, and hope for the best. But the reality is that people with those serious mental illnesses die 15 to 20 years earlier than the general population. So that really goes to show that we're not having the impact that we want. And most of that early mortality is due to cardiovascular disease from lifestyle and from the medications all combined. So yeah, people I think assume that that's all from suicide. It's a little bit from suicide, but most of that is actually from metabolic disease.
Wow.
Cardiovascular disease. Yeah.
Well, first of all, I'd like to say, God bless you for the work you're doing. I think it takes a superhuman to deal with that population and to have the patience and the tenacity to deal with that population. That's a tough job that you have. And so I just want to thank you for taking that on, because I know that's not easy. And I also want to say that I tend to be the defender of physicians because my husband's a physician and I've worked with physicians for so long. So I always like to just reiterate, in case there's people that are not providers listening to the show, that, psychiatrists were not trained on nutrition and metabolic and cardiovascular disease, right? I mean, you got a little bit of that in your medical training, but as far as like the psychiatric practice and how psychiatric medicine is supposed to be done, none of that was incorporated. So we can't fault somebody. I always say we can't fault somebody for ignorance, right? We can't fault a physician for not having these other trainings in their, when they went to school. So, but like you said, it is a choice to further your training after you get out. And I love that you've taken this in the functional and integrative track, because I do think that is a lot to be uncovered there. So that's really super cool. What are some of the most common root causes that you see in your patient population, and how do you address them?
Yeah. So, I'm really focused these days on metabolism. There's now really overwhelming evidence that metabolic health and brain health are intricately connected. Some people even go so far as to say they're one and the same, that your metabolic health is your brain health. Because the brain is the most metabolically demanding organ in the body by far. So the brain is about 2% of the weight of the body and is using over 20% of the energy at any one time. Plus, the brain is very sensitive to this idea of insulin resistance. All the psychiatric conditions are associated with brain insulin resistance, which essentially means that we can have a normal blood glucose level or even an elevated blood glucose level, but the brain can't get the glucose into the neurons for use as energy, because that requires insulin signaling to be working correctly. And so that's a huge issue. And so it's really going to this idea of nutrition, which, again, you're absolutely right. We don't get trained in nutrition in medical school almost at all. Certainly when I was in medical school, some schools now have a little bit more nutrition, but even the nutrition that people are going to learn isn't going to provide these types of benefits that I'm talking about. And
Right.
I'm talking specifically about using a very certain diet called the ketogenic diet, which we'll get into. People, I'm sure, have heard of this, but don't really quite understand it from a medical perspective. This is a diet that was invented by doctors over 100 years ago at the Mayo Clinic to treat epilepsy, another brain condition. And it's been shown in 13 randomized controlled trials to work in epilepsy, both kids and adults, even when the medications don't work. So some kids could be on 3 different anti-seizure medications at the same time, still having breakthrough seizures all the time. They get put on a ketogenic diet and they can often come off all their anti-seizure medications and get excellent seizure control just from this diet.
Wow.
And the other, even most amazing thing is that they can sometimes stay on that diet for a few years, come off the diet if they had a good response, and they don't have their seizures come back and they still don't need to be on medication. So it really provides this almost permanent healing of the brain, which we don't see in any of these medications. That doesn't happen with any anti-seizure medication. We almost never see this in psychiatry as well, where someone can just come off their medication no problem because their condition is completely healed. People end up staying on these medications for many, many years, sometimes a lifetime.
Right. I was gonna say a lot for life. Yeah.
Yeah. So it's very exciting. And so when I
Yeah,
learned
let's
about
dive
that,
into the keto thing, because this
yeah,
is, this is a real big part of the podcast is, the patient impact. Yeah, tell us more about keto and why. First of all, tell us what keto is. Just, I
yeah,
mean, for those of us that, because I don't know what it is, and
sure.
also give us the short story on why it works.
Yes. So ketogenic diet, when it was invented, they were trying to mimic starvation. Starvation, when someone doesn't eat for a couple of days, they start making ketones. So essentially, you're breaking down your fat for energy. Fatty acids are circulating around, and they're now the main source of energy for your cells. Except fatty acids don't get into the brain, so the liver chops up those fatty acids into these things called ketones, and your ketones level rise. Those get into the brain, and there's the wonderful source of fuel for brain cells, and they don't require insulin to get into those neurons.
Okay.
And so we're bypassing that problem of brain insulin resistance when we get someone into a ketogenic state. And the way we do that is we actually need to do a high fat, moderate protein, very low carbohydrate diet. So it's very different than how the standard American diet, where we're recommending people eat 50% of their calories from carbohydrates. In this diet, we're really reducing that way down to about 5% of calories, and then 15 to 20% of calories from protein, which is pretty normal, and then the rest of it is calories from fat. So that's very different than how people are normally eating.
And give me an example of fat. Like what kind of food would that be?
Well, we try to emphasize healthy fats. So everyone sort of agrees that healthy fats include things like extra virgin olive oil, avocados, avocado oil, the fats from nuts and seeds. These are all considered monounsaturated fats. Everyone agrees those are healthy.
Okay.
But in addition, we'll include good quality polyunsaturated fats and saturated fats as part of that whole picture of fatty acids that people are eating.
Like a salad with olive oil and avocado, and
people tolerate dairy well. They could have some cheese on the salad as well to get more fat in there.
Okay, I love cheese.
extra olive oil. And so, that would be a typical lunch on a ketogenic diet. Maybe for breakfast, people might have some eggs, maybe some sausage or avocado or sauteed spinach on the side. Things
and then
like
at night you'd be doing a protein again, or
protein and a vegetable, but not a starchy vegetable. So, non-starchy vegetable.
No potatoes.
No potatoes. Yeah. And so,
Right.
I mean, it's for some people.
I'm kind of a ketogenic fan because I try to avoid carbs. I find that I just run. I when I do carbs, I feel like heavy. I feel lethargic, and then of course I'm trying to keep my weight. I'm 54, so I'm struggling with hormonal weight that women struggle with. So I try to avoid the carbs. So I'm a little bit doing ketogenic. I'm happy to know that.
Well, you're doing low carb.
Low carb, exactly.
Low carb is very good for maintaining weight and fitness. Because essentially when we eat carbohydrates, that's going to stimulate the most amount of insulin. And insulin is our hormone that tells us to store calories as either glycogen or as fat. And so if we're eating in such a way to keep our insulin low, we're not going to store calories. Instead, we're going to burn calories. So this is a very effective strategy for people to maintain weight or lose weight as well. That's not why I'm prescribing it. I'm prescribing
and that's what I was going to say.
For the brain health benefits.
So let's talk about the brain health. So you mentioned that it doesn't have to go through the traditional insulin pathway.
Correct. So we get this additional source of fuel, the ketones, but there's many other mechanisms as well. I'll just list them and we can dive into them if you're interested. So we're going to increase mitochondrial health and overall number of mitochondria. Incredibly important for energy production, and they do much more than just energy production as well. We're going to reduce neuroinflammation. We're going to reduce oxidative stress in the brain. We're going to increase GABA and reduce glutamate, which is very good for mental health. We're going to increase something called BDNF, brain-derived neurotropic factor, which we can increase from exercise as well, but the ketogenic diet independently increases BDNF, which is sort of like miracle grow for the brain. It allows the brain to make more connections, the neurons to connect with more other neurons, and that allows for more cognitive flexibility and better mental health. Okay. And then finally, the ketogenic diet is very good for the microbiome gut-brain axis, and that's one of the other mechanisms by which we think it works for brain health as well.
Fantastic.
So now that we have lots of studies coming out about using ketogenic diets in severe mental illness in the last 5 years, the literature sort of exploding. And so people haven't been paying attention to that. I want to alert people that there are now some pilot studies, large case series showing really remarkable outcomes in people with severe mental illness using a ketogenic diet for their symptoms and allowing people to get on much lower doses of medication, which has its own benefits to reduce medication burden.
That's fantastic.
Exciting. Yeah.
That's really cool. And you touch on a lot of things that the keto diet is assisting with. You touch on mitochondrial health. Mitochondrial health is kind of big in the news right now. Everyone's kind of getting into mitochondrial health. And a lot of it is get out into the sun, get the good sun, right? The sunrise sun, get the sunset sun. Is that part of your prescription, if you will? Or is it just the ketogenic diet gives you that mitochondrial boost?
The ketogenic diet does give the boost, but I would like people to boost their mitochondrial health every possible way. And so the program that I recommend is every aspect improves mitochondrial health. So absolutely
Mhm.
what you just described, circadian rhythm alignment, getting morning sunlight, and actually sunlight throughout the day really helps with mitochondrial health. Light is a nutrient for those parts of the electron transport chain that, allow the mitochondria to make energy. And so we want natural sunlight, throughout the day, not to the point of getting a skin burn, but
Right,
more sunlight than the dermatologist would recommend, for
right.
sure.
Yeah, a
And
lot of
then
science coming out about that now.
yeah. And then in addition, exercise is incredibly powerful for mitochondrial health as well.
Hmm.
Probably second to food, the most important way to boost mitochondrial health is exercise. And then finally, I'm very big on people doing some kind of mind body or mindfulness practice as well, because we now know that the mitochondria actually respond to our autonomic nervous system state. So if we're always in fight or flight sympathetic tone, our mitochondria don't function as well as they do
Sure.
if we have parasympathetic dominance for at least part of the day and overnight. And so we need to really pay attention to that with people with mental health conditions as well.
Yeah,
So
and
I've
I
seen people do everything right, but they're not doing that, and
yeah.
they don't get the benefits unless they add that part in.
Yeah, and I always like to touch on this because a lot of people think mindfulness and meditation is, you have to go and you have to sit and cross your legs and sit there and meditate and close your eyes and all that stuff. For me, and you can correct me if I'm wrong, doctor, but mindfulness for me is anything that brings you to a calm state. So for me, it's going to the beach and just looking at the ocean and just being quiet or reading a book. That resets me. That's
Yeah.
my meditation. I'm not really good at sitting there in a meditative situation. I've tried it. It's
Yeah.
very difficult for me. I just have really high energy, but the ocean somehow naturally does that to me. And I've talked to people that are like, I get that when I go to the woods, or I
Right.
get that when I go to the desert, or I get that when I go to the mountains. So whatever works for you. Do you agree with that? Or do you think we actually need to sit down and do the
No, I agree with you 100%.
Okay.
But I think it's the one thing caveat I would have there is that someone really needs to know themselves to know if they're getting the benefit from that. Like, you get into that calm, restful state when you're at the beach. You know what that feels like. Some people don't even know what it feels like.
Yeah.
And so there may need to be a
They might
little
have to do a
work.
little testing.
I mean, there can be some ways to test, actually. You can test your heart rate or your heart rate
Okay.
variability, especially HRV, heart rate variability. After doing a practice, you should see an elevation in your HRV
Okay.
immediately, from a practice that gets you in a parasympathetic state. So there's definitely ways to measure it, but so that would be the one caveat. But absolutely, you're right. It doesn't have to be any one thing. There's many roads to Rome on this one,
Okay.
and people
Great.
have to find the one that works for them. Yeah.
Okay. Anything else other than I know ketogenic metabolism is really like that's your big thing that you're focused on now, and I love the fact that you're an educator because now you're bringing this knowledge to the students. This is fantastic. Anything else besides that you want to talk about that you're utilizing just for other psychiatrists that might be listening?
Sure. Yeah. I mean, I think the other part about all this is just really appreciating how important it is to lower medications when there's an opportunity to do so. I think we often get used to the idea that someone gets on a dosage of a medication and they're going to stay on that dose indefinitely because that's the one that helped them. That's the dose that helped them. And we don't think about that burden that that person is now experiencing from that medication. And in particular, I'm thinking about things like the antipsychotic medications, which are now being prescribed for many different mental health conditions, and mood stabilizing medications, again, are now being prescribed for all kinds of different psychiatric conditions. And these medications not only have a metabolic burden, they have a burden on the dopamine system, especially these antipsychotic medications, which really reduces motivation and quality of life for people. And there's a really excellent study showing that trying to reduce those antipsychotic medication leads to better long-term outcomes, even when people have, in the short run, more symptoms of their illness. Let's say, we reduce the antipsychotic, someone has a psychotic disorder, they may have more symptoms of psychosis in the beginning, but in the end, 5-7 years later, those people where we tried to reduce the doses are having much better functional outcomes. Things like living independently and having relationships and jobs and things like that are much more likely to happen when people are on lower doses of these medications. And so
I love
trying
that
to find
yeah.
other ways to help people feel well, like all the things we've been talking about today, is so important because it allows us to lower those medication doses, reduce those physical side effects and brain health side effects from these medications.
I love that you brought that up. I met somebody once that had been on long-term antidepressant medication, which I'm not sure where that falls in your category there, but they told me that they had to get off them because they could not pee anymore. And I said, "Excuse me?" They said, "Yeah, my penis would not, I felt the horrible urge to pee, but it was not working anymore." And I'm like, "Oh
Wow.
my God, that must have been horrible."
Yeah.
Yeah, I guess that's a
Yeah.
side effect of long-term antidepressants. I didn't, but
It's
this was
not a
something.
common one for
Yeah,
sure, but
yeah,
but these medications that we
can
use
have long-term side effects.
can have all kinds of side effects, and that's because we're working on neurotransmitters that are used all throughout the body. These, there's receptors for all of these, what we call neurotransmitters: serotonin, dopamine, norepinephrine. There's receptors all over the body for these chemicals, and so we're affecting all different parts of the body. We're not just affecting their depression when we prescribe an antidepressant. Or we're not just affecting the serotonin in their brain. We're affecting serotonin everywhere, and so people can have all
Mm,
kinds of side effects that are unexpected and unusual
right.
with these medications. Yeah.
And let's talk for a minute because I'm just going to guess as a layman that patients are going to be really resistant to that. Like, I like my medication. I don't want to come off my medication. I feel good. I don't want to go back to being the way I was. How do you guide them through that? How do you say, "Listen, here's the long-term goal. We're going to be tapering you down." And the patient's like, "No, I don't, I don't want to go back to being the way I was. This helped me become somewhat normal." Like, how do you deal with that?
Yeah, certainly people, and understandably, don't want to go back to being ill. If someone got stabilized, let's say,
Right,
they
right.
have, bipolar disorder type 1, and they had a couple of manic episodes and depressions, and they get put on a medication regimen. Often in that illness, people end up on 4 or 5 medications, psychiatric medications, very
Okay.
common.
Okay.
And so here they are, they're not getting hospitalized anymore. They're not having big manic or depressive episodes, but they're not back to their full level of functioning they were before. So the part that I don't think is usually occurring is them saying, "I feel great on these medications." That just does not happen.
Right, right. They're saying, "I feel better, but
I'm
not."
glad I'm not getting hospitalized, but I don't feel well is
Right,
what I
right.
hear over and over and over again. I don't like how I feel on these medications.
Okay.
And that's the complaint that psychiatrists hear all day long. "I don't like how I feel on these medications," especially if they're treating these types of illnesses, these types of medications. It may not always be the case with an antidepressant. Some people can feel pretty good on an antidepressant, but still on antidepressants, sexual side effects are more than 50% of people if we ask, what's going on. So they may be
Wow.
feeling okay in terms of their depression and they're back to being able to work, and but if they're having sexual side effects, that's impacting their quality of life significantly, if we ask them about that. So it's more common to people say, "All right, I don't want to go back to being ill, but I don't like the way I feel. Can you do something to help me feel better so I can function better, I can stay awake, I can feel motivated, I can have energy, I can concentrate." All these things get affected by the medications.
Of course.
And so, yeah. And so now I can say, yeah, I do. I've got something that really can do all of that. But you got to, make some big changes in your lifestyle, including what
Right.
you eat. And it's not easy for everyone to do all those changes. But when people do it, we're just having absolutely amazing results. People,
Love it.
feeling better than they have in decades.
Awesome.
Yeah, it's really cool. Yeah.
Well, that's the joy that I get of doing this podcast, is hearing from you, functional medicine, especially the MDs, that have kind of transitioned from traditional medicine in kind of this hybrid. The results that I hear coming from the physicians about the patient's recovery is just amazing. All right, I do want to talk just a couple of things for the providers listening. What are some of the labs and diagnostic tools that you find most essential to uncovering these underlying imbalances?
So yeah, I do very thorough lab work, much more thorough than I used to do as a regular psychiatrist. But it's
Well, I
not
don't think
all.
most psychiatrists do lab work.
Yeah, a little bit.
And
I
that's what I
mean,
was told anyway, but I don't know.
yeah,
I'd
well,
have to ask my psychiatrist if he
yeah,
told that.
but
I
it's
haven't
real
confirmed.
basic screening kind of stuff.
Okay. Okay.
Typically, we might get a a comprehensive metabolic panel and a CBC, and depends on if they're on a medication like a mood stabilizer. We might check the blood level of the medication.
Okay.
We may look at their kidney function and thyroid function if they're on lithium, for example.
Okay.
Now I'm testing, all these metabolic markers. So I'm getting thorough lipid panels. There's an advanced lipid panel that looks at the fractionation of different size of LDL and HDL particles. I'm getting hemoglobin A1Cs on everyone. But in addition, there's something called a HOMA-IR, which really tells us the actual insulin resistance. So that's even a much more sensitive test for insulin resistance than the HbA1c. Checking things like homocysteine, uric acid, these full iron panels, B12 and folate, copper levels, and ceruloplasmin levels. So, that's just some of them. There's more, but I don't want to, but there's a lot more testing that is useful and pertinent to this treatment than there is in standard psychiatric treatment.
I love it. Typically, I go into, the challenges and, running the business. And because you are a very well educated and very well respected psychiatrist. You've been a medical director, so I don't think you have struggled with a lot of the things that an independent private, primary care physician struggles with when they open a functional medicine. So with that said, I'm going to kind of skip that part for today because I'm enjoying so much the education that you're bringing to this podcast. And we're going to go right into what are the trends in functional and integrative medicine on the horizon that you are most excited about?
So I really think this metabolic treatment for psychiatry for mental health is about to explode. And part of the reason I say that is that there's a group that's funding a lot of research on this. And so there have been a few papers that have been published that I mentioned, but there are now in process a bunch of randomized controlled trials using ketogenic diets for mental health disorders. And so those are going to be published in the next couple of years. And there's really almost like a grassroots groundswell going on amongst patients and families for this treatment, because people are hearing these stories from people who say, I was mentally ill for 30 years and now I'm off all my medications and I've never felt as good as this in my entire adult life, because I went on a ketogenic diet. And these people are all over the internet now talking about their individual stories. And so people are hearing this and saying, wow, I am, I've got this, or my family member has this, and we're not having anything close to that kind of an outcome. And we want that outcome. How do we get it? And so people, psychiatrists especially, are going to be hearing people coming into their office and say, what about this ketogenic diet? And I think people should learn about it at this point, because it's really something that, it's beneficial. It's really effective and people want it. And so from a business perspective, it's really good to be on the beginning part of this, because it's just, like I said, I think, from what I'm seeing, businesses opening up and practices starting to incorporate this, it's becoming exponential right now, the growth. Yeah.
And where would you recommend your colleagues get the education on this metabolic?
So there's a few different places to go, but probably the number one website is called Metabolic Mind, and that's run by some of the same group that's funding a lot of this research.
Okay.
So they put a lot of funds into education as well, and all of that funnels through the website Metabolic Mind, where there's lots of videos and other resources. There's links to actual CME talks as well that they're making. So if people want to learn just from a podcast style, they can do that. Or if they want to get CME credit for learning some of this, they can do it through there. And if someone really gets into it, there's training programs that they can go to learn how to do metabolic psychiatry or ketogenic diets for mental health.
I love it. There's one message that you want listeners to take away today about why functional psychiatry is important. What would it be?
It's that we can have much better outcomes. We shouldn't settle for people coming in and having gained 50 pounds on their medication and feel like they can't function, and just settle for, well, at least they're not symptomatic and in the hospital all the time. We can definitely do better.
Thank you. And what is the best way for physicians to reach out to you if they have questions, or for people that may need your services, doctor? How can they find you? How can they get a hold of you?
So, we have a program where we're doing immersive metabolic psychiatry called Accord. It's outside of Boston. It's a residential immersive program. People can come for 1 to 3 months, learn how to do this, and get into ketosis, start feeling the benefits, learn all
Awesome.
the recipes, learn how to cook, exercise, mindfulness, all of it, and then go back home to their providers. So that's a great resource, and the website for that is AccordMH.com.
Okay.
And if people want to connect with me, they can find me on LinkedIn. I'm not on a bunch of other social media. I just
Of
don't really have
course.
time for it.
Most psychiatrists aren't actually.
Yeah, yeah.
But
Some
I'm talking
are.
about for your colleagues, for another psychiatrist. It's like, hey,
Absolutely.
doc, I'm thinking about getting into this, not sure, which direction should I go? So LinkedIn would be the best for your
LinkedIn is
colleagues to reach out. Okay.
they can reach out to me there. I'm happy to answer any questions to anyone who's interested in more in this. Yeah.
Thank you so much for taking the time today to be with us. It was probably one of the most educational podcasts I've had, and I've had some pretty educational ones, but this one, was amazing. So thanks again for taking the time to be with us.
My pleasure. Thanks for having me.
Have a great day.